I have body dysmorphia. I don't ever see myself the way other people see me.
It made me sick when I saw it. What? It's like a liquor. It looked like, it was horrible. I don't like it. I never like it. That's why I wish I could never be photographed or seen, and I push myself to go to the things that we go to.
And is that body dysmorphia, or is this the normal part of being a woman that no one really talks about?
Hey everyone, welcome to today's video. Today we're diving into a topic that affects so many people, body dysmorphia. You might have heard recently that Megan Fox bravely opened up about her own struggles with this mental health condition in the Sports Illustrated Swimsuit 2023 issue.
There's never a point in my life where I loved my body, never ever.
Back in 2008, Megan Fox was crowned the world's sexiest woman by FHM Online's reader poll. It can be tough for people to grasp that someone who is celebrated for their beauty and sex appeal can actually face profound challenges with their body image. I was looking at the social media comments on posts where Megan Fox announced her body dysmorphia, and it seemed like a lot of people didn't really understand how someone like her could be dealing with body dysmorphia. Many comments questioned the truth of her condition just because she shows her body all the time. But let's not jump to conclusions. Just because people show off their body doesn't automatically mean they are comfortable with it. Oftentimes it's the opposite. You can tell that people don't take the news seriously and assume that Megan Fox is just seeking attention or is insecure. The truth is, only her doctor or mental health professional can confirm if she truly has body dysmorphic disorder. But it's important to note that body dysmorphic disorder is real and can impact anyone, regardless of how they look.
And I've faced criticism in the past for talking about my body image. People told me that I didn't have the right to talk about being self-conscious about my body because I was skinny.
It's a serious mental health condition. So, in this video, we will talk more about what body dysmorphia is all about. We will delve more into the story of Megan Fox and other celebrities, the signs to look out for, what might cause it, and the different treatment options available. We'll also touch on an important topic, whether or not cosmetic procedures are the right answer for individuals dealing with body dysmorphia. So, let's jump right in and learn more about this complex issue together. Let's get started. Before we begin, I want to hear from you in the comment section. Let me know if you have personally experienced body dysmorphia or if you know someone who has. I want to understand how familiar people are with this disorder. Also, for those who are new here, I am Dr. Kim de Tollenijde and I make videos about everything related to beauty and medicine. If this sounds interesting to you, then please subscribe to my channel and check out my other videos. You can also check out my blog, drcontour.com, and my other social media channels for more information. What is body dysmorphic disorder? Now, you might be wondering, what exactly is BDD? And what is the difference between having BDD or just being a little bit insecure? Well, body dysmorphic disorder, or BDD, is a mental health condition where people become fixated on perceived flaws or defects in their appearance. These flaws might be things that others don't even notice or are really minor, but for someone with BDD, they become super self-conscious about them. It's like they can't stop thinking about their appearance and it starts taking over their life. They might spend hours obsessing over how they look, checking themselves out in mirrors all the time, asking for reassurance from others, or even going through multiple cosmetic procedures. Now, the fancy diagnostic manual called the DSM-5 has some specific criteria for diagnosing BDD. So to be officially diagnosed with BDD, a person needs to meet these criteria. 1. They are totally preoccupied with one or more flaws in their appearance that others might not even notice or think are a big deal. 2. This preoccupation causes them a lot of distress and messes with how they function in social, work, or other areas of their life.
I'm extremely introverted and I don't do a lot of events. It is really hard for me. This morning was really hard for me, like working myself up into knowing where I was coming and what I was going to do.
3. They start doing repetitive things like checking themselves out in the mirror all the time, grooming themselves excessively, or seeking constant reassurance from others. They might even compare themselves to other people constantly in their mind. 4. 4. Importantly, this obsession with appearance can't be better explained by concerns related to body weight or shape as seen in eating disorders. Now, let's get into the nitty-gritty of how BDD is different from just feeling insecure. We all have moments of insecurity about our appearance, but BDD takes it to a whole new level. 1. How serious and obsessive it is. With BDD, the concerns are like a non-stop roller coaster in their minds. They can't shake those thoughts and they might spend hours and hours each day worrying about how they look. It's not just a passing thought, but an all-consuming obsession that causes a ton of distress. 2. Perceived flaws. In BDD, the perceived flaws are often things that others wouldn't even notice or think are a big deal. But for someone with BDD, they are convinced that these flaws make them look disfigured or defective. Insecurities, on the other hand, might come from comparing ourselves to others or feeling pressure from society's beauty standards. And 3. How it messes with life. BDD seriously messes up different areas of a person's life. It can strain relationships, make it hard to work or go to school, and even lead to isolation. Insecurity might affect our self-esteem, but it doesn't usually have the same level of impact on daily functioning. Body dysmorphic disorder, or BDD, is actually quite common, impacting about 1 in 50 individuals. Surprisingly, it tends to be underdiagnosed and underreported. You might think that BDD mostly affects women because of the societal pressure to meet certain beauty standards. However, it's crucial to understand that BDD affects both men and women equally. And to shed some light on this, let's take a look at an interview with a male celebrity who opened up about his own experience with body dysmorphia.
You're here to talk about body dysmorphia, which a lot of people might be very surprised to hear because, you know, we all saw you on Love Island, always in your shorts, ripped, as the young kids say. People might be surprised to hear that you have struggled with body image for years.
Yeah, I mean, I think people would be surprised to hear that, but I think any person that has went through a dramatic weight loss period or has struggled with something when they're younger, they always have that voice in the back of the head of, like, I still feel like the little boy that was overweight and got a hard time in school. And I think it happens to so many people, but also you can't be so hypercritical of yourself once you get to your goal or once you are starting to make progress. You constantly still have that in the back of your head.
How
So
overweight were you?
If you look at yourself now, do you still see imperfection?
Yeah, absolutely. I'm content to a certain degree, but I was never satisfied, and I still am not satisfied. I mean, everyone praised my sort of body image in the villa, but nobody saw 3 days before when I was in lockdown in a villa. I was having a meltdown being like, everyone's going to be bigger than me, everyone's going to be leaner than me. I'm not good enough right now at this point.
Many stars have spoken out about their struggles with body dysmorphic disorder. Other stars who are suspected to have suffered from BDD are Michael Jackson.
When you look in the mirror, are you happy with what you see?
I'm never totally satisfied. I always wish the world could be a better place. No, not at all. I saw it on the computer. It made me sick when I saw it. What? It's like a liquor. It looked like, it's horrible. I don't like it. I never like it. That's why I wish I could never be photographed or seen, and I push myself to go to the things that we go to. I just don't want to look old. I hate to see people grow old.
Lily Reinhardt.
Tell me about the body dysmorphia and when did that start?
I had it when it kind of developed in 8th grade so I was 12, 13, and my skin was really bad. So I started to deal with it, not about my body, but very much focused on my skin. I was doing my makeup in the dark. Like, I didn't want to wake up and turn on the fluorescent lights in my bathroom and stare at my acne. So I would do it in very dim lighting. I would not want to look at myself, but then also was obsessively looking at myself to try and see how I looked at different angles, to look at the acne at different angles. And it's kind of like I hate looking in the mirror, but I have to, obsessive sort of component there.
Billie Eilish. I've never felt comfortable in really tiny clothes, she says. I was always worried about my appearance. That was the peak of my body dysmorphia. I couldn't look in the mirror at all. And Robert Pattinson. Body dysmorphia, overall tremendous anxiety. I suppose it's because of these tremendous insecurities that I never found a way to become egotistical. I don't have a six-pack and I hate going to the gym. I've been like that my whole life. I never want to take my shirt off. Sarah Michelle Gellar once admitted admitted to having body dysmorphic disorder, followed by her statement, "I think most women do." Well, I don't believe that is entirely true. I do believe that a lot of women suffer from body image issues, but it's important to understand that BDD is not just about having body image problems. However, it is believed to be severely underdiagnosed and it affects more people than we think, especially in today's world. Now, what can cause body dysmorphic disorder? BDD often develops during the teenage years and can be influenced by various factors. Bullying, childhood abuse, and genetics can all play a role in its development. Moreover, societal pressures can worsen these factors and contribute to the development of BDD. If someone in your family has experienced body dysmorphia, it does increase the likelihood of you experiencing it as well. For example, Michael Jackson had an abusive childhood, with his father repeatedly calling him ugly, and he suffered from acute acne as a teenager.
And Joseph told me, "Oh, you're so black," or "You have such a big nose." He told you you were black? Yes, when I was little. "You are so black. You don't look like my child. Your nose is so big," and this and that. They used to call me Big Nose and stuff. And instead of retaliating on them, I just did it with myself.
Is it true that your father used to say you had a fat nose?
Yeah.
What did he say? What did he actually say?
God, your nose is big. You didn't get it from me.
What does that do to someone who's going through adolescence?
You want to die. You want to die. And on top of it, you got to go on stage in the spotlight in front of hundreds of thousands of people and just, God, it's hard.
In later years, he led an isolated life and frequently covered his face using a surgical mask when out in public.
I would have been happier wearing a mask.
When it comes to Megan Fox, she says that she doesn't know where the body dysmorphia comes from, but that it has always been there.
When I was little, like that was an obsession I had of like, but I should look this way. And why I had an awareness of my body that young, I'm not sure.
However, I found this video fragment where Megan Fox talks about how she was always being sexualized from a very young age when she was in Hollywood. She also spoke about being there before the Me Too movement gained prominence.
How sexualized I was and how I was like reduced to, I mean, objectified is like, it's not the right word. It doesn't capture what was happening to me at the time. I had, I think, a genuine psychological breakdown probably, where I wanted just nothing to do. I didn't want to be seen. I didn't want to have to take a photo. I didn't want to have to do a magazine. I didn't want to have to walk a carpet. I was sort of out in front of the Me Too movement before the Me Too movement happened. Like I was speaking out and saying, you know, hey, these things are happening to me and they're not okay. And everyone was like, oh, you, we don't care, you deserve it.
It's also when you have to live that as a celebrity where you know that every photo of you is analyzed down to like every eyelash and eyebrow hair and every acne scar, and you know that your faults are, so people comb through everything to find all the faults they can instead of just being like, hey, this is a healthy, nice girl. You know, that's not something that is an option for me. So when you have something like any type of insecurities, but especially something like a body dysmorphia, that amplifies that. And makes it very difficult.
Megan Fox has been involved in modeling and acting since her early teenage years. I do think that in general it must be hard to grow up in an environment where there are high expectations regarding your looks and where looking perfect is almost a requirement for acceptance. Hollywood and the entertainment industry in particular can be very shallow, placing a significant emphasis on appearance. And I truly believe that this kind of environment can have a profound effect on our psyche. But even for us regular people who don't have a career in Hollywood. In 2023, we are living in a visual society where beauty standards are extremely high and constantly reinforced, especially through social media and movies, and it can leave us feeling unsatisfied with our own bodies.
But my point is, I didn't think anything was wrong with my body until I was in an industry that rewards and praises people for having a smaller waist than I will ever have.
But hopefully, for most of us, it won't get as bad as to develop body dysmorphia. treatment options. Alright, let's dive into how we can support people dealing with body dysmorphia. There are different approaches to treatment that can make a difference. One popular method is a cognitive behavioral therapy, which focuses on changing negative thought patterns. You know, it's all about reshaping how they view themselves. Sometimes medication like selective serotonin reuptake inhibitors can be prescribed to help with the associated anxiety or depressive symptoms. Oh, and we can't forget the power of support groups. Being surrounded by others who understand what they are going through can provide a lot of comfort and encouragement. Here's the thing, BDD can't be completely cured, unfortunately, but with proper treatment, individuals can experience significant improvements in their symptoms and overall quality of life. The goal of treatment is to help them develop healthier coping mechanisms, boost their self-esteem, and learn effective ways to manage their symptoms. It's all about finding strategies that work best for each person and helping them navigate through this challenging journey.
The journey of like loving myself is going to be never ending, I think.
How do you still overcome that, and what advice do you have?
So I have not overcome, but I am just functioning as best I can.
Cosmetic procedures and BDD. What do Megan Fox and Michael Jackson have in common? Well, besides being famous celebrities, they both underwent multiple cosmetic procedures in their pursuit of enhancing their looks. But here's the thing to keep in mind. Just because celebrities in Hollywood opt for numerous surgeries doesn't automatically mean they have body dysmorphic disorder. As I said before, in the entertainment industry, there's immense emphasis on looks, and the pressure for perfection can be intense. While this emphasis on appearances may drive many to undergo cosmetic interventions, it's crucial to understand that BDD is a distinct psychological condition. Getting cosmetic procedures done is not abnormal in itself. By the way, I must mention that I'm a big fan of the YouTube channel of Lauryn Hill. She analyzes the various cosmetic surgeries that celebrities have undergone to achieve their desired looks. It's truly an eye-opener, so I highly recommend checking it out. Now, it is true that individuals with BDD often turn to plastic surgery and dermatological treatments, hoping that these procedures will somehow fix their perceived flaws. Studies have actually found that around 15% of plastic surgery patients and 12% of dermatology patients have been diagnosed with BDD. And this highlights the high prevalence of BDD among those who pursue such procedures. However, it's important to understand that people with BDD often have unrealistic expectations. They believe that these cosmetic procedures will solve all of their problems, including issues beyond their appearance. Unfortunately, that's not how it works. Cosmetic procedures are not designed to address the underlying psychological issues associated with BDD. Research consistently shows that individuals with BDD tend to be dissatisfied with the results of their cosmetic procedures. They may continue to obsess over their perceived flaws or develop new obsessions about different aspects of their appearance. And due to these reasons, BDD is considered a clear contraindication for cosmetic surgeries and procedures. In conclusion, body dysmorphia is a genuine and challenging mental health condition that can impact anyone, regardless of their perceived physical beauty. The experiences of these celebrities serve as reminders that nobody is immune to the struggles of body image. It's crucial to understand that body dysmorphia is not a choice, but a legitimate disorder that requires empathy and support. If you or someone you know is dealing with body dysmorphia, it's important to seek help from a mental health professional. Treatment options like cognitive behavioral therapy and medication can provide significant relief and assist individuals on their path towards self-acceptance and improved well-being. It's worth noting that cosmetic procedures are not a solution for individuals with body dysmorphic disorder. In fact, they can often worsen the condition and lead to further dissatisfaction. Thank you for watching this video. If you found it informative or helpful, please consider liking and sharing it to raise awareness about body dysmorphia. Don't forget to subscribe to my channel for more videos. Take care, and I'll see you in the next video. Bye!